Jackie Dillon was just 35 when she felt like her body turned against her.
I started having heavy periods. I had anxiety and I was starting brain fog and things like that.
While normally comfortable taking charge at work and home, Jackie was suddenly struggling to remember simple things.
I remember going to pictures and watching the movie about a woman who had early onset dementia and thinking, that's me.
Eventually, Jackie went to her doctor in search of answers.
Did lots of tests, lots of biopsies and things like that, and came back with nothing, and they said, don't quite know what it is, and probably if you're not having any more children, we'll give you a hysterectomy.
But her symptoms only got worse.
I went from what I think now was perimenopausal to postmenopausal almost overnight, and it was horrific. It was the worst. I was, my hair was falling out, I had heart palpitations, and I just lost control of everything.
Jackie found herself at breaking point until she opened up to a colleague.
Just one day we were in her kitchen and it just all came out, and I was like, I'm not coping, I don't know what's going on. And she said, I think you're going through menopause. And what's menopause? What's that?
Menopause happens when periods have stopped for at least 12 months as a result of falling hormone levels. The average age for it to occur naturally is 51, but it can also be triggered by the removal of reproductive organs or medical treatments like chemotherapy. Perimenopause tends to kick in around 7 years before the end of periods. Both can cause symptoms like brain fog, anxiety, mood swings, and hot flushes. Caroline was able to see a lot of her own struggles in Jackie's experience.
When I hit perimenopause, I was just, I think 40, 41, and I had a young son at primary school. And what happened to me was I started to suffer really bad from rage, and then I started to suffer really bad from depression, which I never had, really bad heart palpitations. Oh my goodness, itchy skin. Oh my, that was from head to toe. That was an absolute nightmare. Went down to my GP and they said to her, look, I'm having a real hard time here. She said, you're 45, you're going to be 50 in 5 years' time. This is going to get a lot worse. That was me. And I came out of that GP surgery absolutely devastated because I had no idea what was going on.
Caroline had to rely on online forums to see how other women had managed their symptoms. And when speaking to Jackie, they decided it shouldn't be so hard to find support.
We realised that talking to each other was really helping us. And we just said one night, why don't we try a support group and see what happens? Thank you for coming along. So how are we all doing this evening?
Menopause Warriors Scotland was set up shortly before the pandemic, and now it has 7,000 members. Every month, the group hosts a meet-up.
When you see our support group on the face-to-face, they come in, they're terrified, they're worried, they think they have dementia, all these things are going on, but we can guarantee by the time they leave, totally different, because they realise it's normal, there's help, and there's options.
There's nothing particularly awful about my daughter. She's just 15.
Teenage years.
But I've got rage like you wouldn't believe, and so I just can't deal with teenage hormones. My daughter's 23 and we were butting, and now different relationship, so hold on, just keep holding on, it will get better.
The sessions have been a lifeline for Lorraine after her hysterectomy.
I found this group and they've saved me. I'm not alone anymore. I felt really lonely up until that point. My husband is an absolute saint and puts up with a lot, but he doesn't understand it. They understand me. I don't feel like an absolute pariah when I'm telling them what I'm going through.
For many women, the sessions help to bridge the gap while figuring out how best to manage their symptoms.
Well, you were having perimenopausal symptoms and the solution was a hysterectomy. How does that make you feel now looking back?
Neglected and angry that they took away part of my body when really there was other options there, but because they didn't know about the options, But it was, now looking back, it's very, very annoying.
One of the issues many women face is accessing hormone replacement therapy, or HRT. It tops up the hormones which start to fall during perimenopause. But getting a prescription and the right dosage can be a challenge.
So the GP saying have more estrogen is not, for me, I don't think it's right, but I mean, still a blanket no on testosterone.
They still come and say, we don't know what this is, we've been given it, how do I take it, where do I put a patch, how do I put the gel on, you know, and the group is amazing for the shared lived experience.
Morning, Jaya. How are you?
Dr. Karen Aitken is a former GP who now runs a private menopause clinic.
Challenge, I suppose, for GPs is the time factor, first and foremost. Even the most expert doctor is going to struggle to get through that kind of consultation. I think if women are accessing their local GP, their difficulty perhaps in accessing that might be geographical. So if you live in a rural area, there may not be as much access to GPs with different expertise as there may be in the Central Belt.
The NHS does run menopause clinics in Scotland, which can offer advice about the likes of HRT. But Orkney, Shetland and the Western Isles don't have any specialist services, and women are instead referred to gynecology or sexual health clinics. Some women in the Western Isles even have to travel to Glasgow. In areas which do have menopause clinics, women often face waiting months just for their first appointment.
We've had reports in the group of 44 weeks, 94 weeks elsewhere. I mean, unacceptable, because see at the point where you have to go to your GP because you're struggling, you need help.
We've looked at possibly going private. I've spoken to other, within here, and I know that it may then have barriers, but for my husband, it's what I need to be me again.
Karen says many women come to her because they can't wait months for help.
I find lots of women come in and they spend the beginning of the 45 minutes really quite upset, just talking about their family and their relationships and how much their lives have been affected by their symptoms. So having that longer time period to talk about it is really important.
It's not just within healthcare that women are calling for better support. Jackie has been off work sick for 2 months because of her perimenopause.
I've got 2 young children, so I need a lot of energy, but some days I was waking up and I could hardly get out of bed. I felt as if I'd been run over by a bus. And then by the time I took the kids to school and everything, I just felt, oh no, I've still got to go to work. And I was exhausted, and working with men who didn't understand menopause just made me feel rage.
The British Menopause Society says 45% of women feel menopausal symptoms have had a negative impact on their work. But some workplaces are trying to change that.
No, come on in. I think what we'll do, can you use me?
Kilbride Hospice has introduced free yoga sessions for its employees to help with the physical and mental toll of menopause.
When you're ready, coming forward, push into the hands.
We have the highest proportion of our staff and volunteers are women, and it's important for us to recognise the different symptoms that people can go through.
Even if you are using HRT or if you are using other medical interventions, you can use this alongside. You also find that there are women who, for different reasons, can't use HRT, and that they're choosing not to use HRT. So having these different alternatives, it's just about choice. It's giving women choice.
You're bringing the arms up.
Classes like this won't solve the issues women face at this major junction in their lives. But it's hoped that by changing attitudes towards it, it can become far more manageable.
Where do you see the future of menopause care? Do you think we are heading towards a greater understanding, better care for menopause?
Absolutely. Yeah, absolutely. I think we are seeing doctors being taught about menopause at an earlier age. I think school provision and education is coming through as well, and women in groups across the country are having conversations about it, which is great.
Once you manage it, I actually think this is a great time.
So do
I really do. I think this is a fantastic time now. It's our time, but it's important that we recognise it, we understand it, and we look after ourselves.